Hello everyone. This is Dr.Monisha, MDS, Conservative Dentistry and Endodontics, and Assistant Professor. Today, the topic that I'm going to take about is known as remaining dentine thickness. Now imagine you have a hot burning pan and you want to keep it on a wooden table. Wouldn't it cause harm on the wooden table? Rather, what do? You place a coaster as a protecting agent between your heated pan and your wooden table, and that sorts all the problem. Similarly, when you have your pulp and when you have very less dentine remaining, what do? You apply something known as pulp protecting agents, which are classified as liners, varnishes and bases. So why are these pulp protecting agents important? Say for example, you are going to put dental amalgam. We all know dental amalgam is a metallic material. Now, if you place it directly on the pulp, or in an area which is very close to the pulp, what happens? It will have electric stimulation. As it is a metal, it can pass electricity, it can cause galvanic shock. At the same time, any force of mastication can also cause excessive pressure from the dental amalgam onto your pulp. Also, since it's a metal, it can pass thermal heat. And at the same time, the corrosive products of amalgam can also cause harm. Therefore, most of the time, we end up putting a pulp protecting agent beneath the dental amalgam. Now, how do we know which pulp protecting agent to use when and under what condition? Here is where your remaining dentine thickness comes into play. So, remaining dentine thickness is defined as the dentine which is left between the pulpal floor of the cavity and your dental pulp. And this is really important because depending on the remaining dentine thickness, you will either apply a liner, a varnish or a base. So say for example, for dental amalgam, if your remaining dentine thickness is more than or equal to 2 mm, you can just apply varnish, also known as solution liners, because you have enough amount of remaining dentine to protect your pulp. Only in deep dentine areas where your dentine is very less, the dentine is very porous and susceptible to desiccation. That's why you need to have a protecting agent. If your remaining dentine thickness is 1 to 2 mm, you can always apply a base. Now for dental amalgam, what do we teach you in preclinical conservative? We tell you to apply a zinc phosphate base. So always remember, if your RDT is 1 to 2 mm, you need to apply a base. If your remaining dentine thickness is very less, there is hardly any dentine present between the floor of your cavity and the pulp, that is less than 1 mm, then you need to place a sub base, say for example a calcium hydroxide liner, followed by a base. Okay. Now this changes for the restorative material you're using. Say for example, if you're using a composite restoration or a GIC restoration and you have good remaining dentine thickness, say more than or equal to 2 mm, you need not apply a varnish because the bonding agent takes care for composites, and for glass ionomous cement, since you have a chemical bonding, it takes good care. On the other hand, if the remaining dentine thickness is 1 to 2 mm, for composite, under a composite you can always place a glass ionomous cement. And if it is much less, the remaining dentine thickness is less than 1 mm, then as we keep doing indirect or indirect pulp capping, you can always place a calcium hydroxide liner followed by a base, which is most probably a GIC in composite, and then finally a composite. So to quickly have a recap, if the remaining dentine thickness is more than or equal to 2 mm, for metallic restorations like dental amalgam, you can place solution liners, also known as varnish. No liner or base is required if it is a GIC or composite and the remaining dentine thickness is more than or equal to 2 mm. If your remaining dentine thickness is 1 to 2 mm, then you can always apply a base. The usual thickness of a base is 0.5 to 0.75 mm. The usual base that we apply for dental amalgam is a zinc phosphate that we apply on the pulpal floor. And if your remaining dentine thickness is less than 1 mm, which means you hardly have any dentine between your pulpal floor and your cavity floor, then you can always apply a sub base, that is a suspension liner, followed by a base. So coming to your trivia questions quickly, what did you take home from this short lecture? Let's find out. If the remaining dentine thickness is 1 to 2 mm, which pulp protecting agent will you give? A. Varnish, B. B. Base, C. Thick liner, and D. Suspension liner. The answer for this is B base, as remaining dentin thickness is 1 to 2 millimeter. What's the another name of varnish? Yes, it is solution liners. And the last one, if you're doing a composite restoration for a patient and the remaining dentin thickness is 2.1 millimeter, which pulp protecting agent will you give? A. Glycinomycin, B. Zinc oxide eugenol, C. Calcium hydroxide liner, D. No pulp protecting agent is required. And the answer is D. No pulp protecting agent is required, as it is a composite restoration. Thank you, and I will see you in the next lecture.